Human Metapneumovirus, or HMPV, is a common respiratory virus that affects people of all ages, especially young children, the elderly, and those with weakened immune systems. The pathophysiology begins when an individual inhales respiratory droplets containing the virus, usually spread through coughing or sneezing. Once inside the body, the virus enters the upper respiratory tract and attaches to the epithelial cells lining the airways using two key surface proteins, known as the G and F glycoproteins. These proteins help the virus fuse with the host cell membrane, allowing it to release its genetic material, an RNA genome, into the cell. Inside the host cell, the viral RNA hijacks the cell's machinery to replicate itself and produce new viral proteins. As these new viral particles multiply, they destroy the infected epithelial cells, leading to tissue damage, cell death, and a loss of the protective mucosal barrier. This damage impairs the mucociliary clearance mechanism, the system responsible for removing mucus and pathogens from the airways, making it easier for the virus to spread deeper into the respiratory tract. The body's immune system quickly responds by releasing inflammatory cytokines and chemokines, which attract immune cells to the site of infection. However, this immune response, while protective, also contributes to inflammation and swelling of the airway lining. As a result, patients experience symptoms such as coughing, nasal congestion, wheezing, and shortness of breath. In severe infections, especially in infants and elderly patients, the virus may extend to the lower respiratory tract, causing bronchiolitis or pneumonia. Here, the inflammation reaches the alveoli, disrupting oxygen exchange and leading to respiratory distress. In summary, the pathophysiology of HMPV involves viral invasion, epithelial damage, immune activation, and airway inflammation, all combining to produce the characteristic respiratory symptoms seen in affected individuals.